Laryngitis, inflammation of the larynx, that is the voice box, which actually now with inflammation is going to cause narrowing of the upper airways. That's going to affect the voice of the patient, so they want to present with a hoarse voice, or sometimes in some cases, aphonia, that is complete loss of voice. I'm sure you've seen friends, relatives who sometimes have lost their voice. Somebody wakes up anawaambia hana sauti, akiongea mnasikia tu anawika tu kwa umbali kama kajogo. That is laryngitis. So that is now complete loss of voice or partial loss of the voice. And this is because now there has been a narrowing to the upper airways. Laryngitis can be maybe acute, which lasts less than 3 weeks, or chronic, which can last more than 3 weeks. That's why one of the first management of laryngitis is to rest the voice. You know, sometimes you see people, they have lost their voice and they make fun of it. They make fun of it in the sense that it's now when they have lost their voice is when now they want to talk more. Mtu anaanza kwamba you now, that's when they want to talk and talk and talk and talk, not knowing that they are now worsening the condition. So always advise any patient who is presenting the laryngitis, loss of voice, let them rest. If you are so used to talking, if you are that talkative person, just find ways of resting, of not talking. If it means isolating yourself, isolate, because that's the only way you are going to promote recovery. So laryngitis will always be associated with the hoarseness of the voice or complete loss of the voice. Sometimes you see it appears even those people who do, singers, or those who even talk too much. Some of you, sometimes you talk endlessly. So you talk endlessly, laryngitis is just there watching you. You will be in problems. So usually it's caused by pathogens that cause the common cold and pharyngitis. The common cold is the rhinitis that we talked about. The pathogens that cause common cold and pharyngitis are the same ones that cause laryngitis. So both viruses, bacteria can cause laryngitis, but most commonly viruses. The H. influenza, the S. pneumoniae can be some of the causes of laryngitis. So can be caused by either infection or trauma to the mucous membrane of the larynx. It can also be associated with the gastroesophageal reflux. We'll be talking about this in the next system we are going to talk about. I believe the next system is the GIT, the gastrointestinal tract system, that we'll be discussing about, and we'll be talking about the gastroesophageal reflux disease, where there is now a reflux of the gastric contents. Remember, those gastric contents are acidic, and that reflux can sometimes corrode the linings of the larynx, and that can also affect the larynx and can lead to hoarseness of the voice or loss of the voice.